Hello friends, and welcome back to part 2 of how to skim a textbook. In part 1, I reviewed the actual steps of how to skim a textbook. So if you haven't seen that yet, go run over there and watch it on my channel, The Hopeful RN. You can even watch it on 2 times speed. Just get the general gist. You could also go to @thehopefulRN, which is my Instagram, and I have the Spark Notes there. So if you look through those, that'll kind of help you when we now, in this video, demonstrate how to do it. Before I get to that, please subscribe on YouTube to The Hopeful RN, and then follow me on Instagram @The Hopeful RN. Again, subscribing really means a lot. Helps me get my base, my followers, and get this thing really up and running so I can keep helping you guys. Okay, let me demonstrate how to skim a textbook. I'm just going to do a section, maybe 2, depending on how. I haven't even found a section yet. We're going to kind of open at random and go from there. I'm using a nursing textbook because that's what I have, but no fear if you are not a nursing student, this same concept works for any type of textbook. Okay, here's my nursing textbook. It's a big one. This is, I think it's like 9 pounds. Basic nursing concepts. Okay, so we're gonna open it at random and see what we find. Gotta make some room here. I forgot how big it was. Okay, here we go. Providing counseling. Okay, that's the heading. So step 1, we said find your topic sentence or your heading. Providing counseling. Sounds like I kind of understand what we're talking about. Now, this is also within the chapter of health promotion. All right, so we're talking about helping people improve. So providing counseling, okay, kind of getting the idea. Now we're going to take in full sentences or paragraphs. So I'm going to read this really quickly, and we're going to kind of see what happens. So first, I'm going to read the topic sentence, right? So I've got my header, providing counseling. Now I'm going to read my topic sentence. Also, any words in bold you're going to want to take note of. So here we have counseling is bolded. Okay, we have a definition. Counseling is an interpersonal communication process that helps a client to identify problems and make changes. Okay, that's our topic sentence. Great. Now, the rest of it, I'm going to read the sentences really fast out loud. In the context of health promotion, counseling promotes personal growth and helps clients change their lifestyle. Counseling may be formal one-to-one or small group discussion, or it may be informal discussion with the client at a healthcare encounter. Each meeting with a client is a potential counseling session. Each meeting with a client is a potential counseling session. In addition to face-to-face contact, counseling may be offered via telephone or even by email. Okay, so what was the general point of the paragraph? Well, it was a definition of counseling, which is a one-to-one encounter, which may be exactly one-to-one, or it may be a group, but it involves a client and a therapist or a counselor, and it's geared towards growth and kind of helping someone improve. I think that was the general gist. All right, we're going to repeat that. So let's see. I have my steps up in front of me so I can make sure I refer to the right things. That's why I'm like looking up a little bit. Okay. Individual counseling. Okay, that's our next header. Individual counseling. So now we're talking about that one-to-one. So not a group setting. We've got one-to-one. Okay. Face-to-face interaction may be helpful when clients are attempting major lifestyle changes. In an individual session, you can customize and map out the steps required to meet the client's goals. This may include writing a contract detailing the client's expected behaviors. Print it out, have the client sign it to reinforce his commitment, suggest that the client post the plan in a location he sees often so it serves as a frequent reminder. That was a paragraph right there. So what did that tell me? Let's see. And just by the way, I picked this paragraph at random, this section. I have not looked at this book in at least 3-4 years, maybe more. So just so you know, this is me gathering information with you guys. Okay, so the general gist of that paragraph was kind of the benefits of individual counseling and how we're going to help someone individually achieve a goal. So the pros of individual counseling are that you can kind of customize it, and then it gave us some tips for kind of where you can put information, like tips to help someone really commit. Okay, got it. During counseling sessions, remember to reinforce health-promoting behaviors that have already been established. For example, the client who uses tobacco may eat a balanced diet. Reinforce the healthy habit to boost self-esteem. Stress to the client that although the behavior to be changed may be unhealthy, you believe the client can succeed in making the change. So believe in them and remind them that they're doing a good job. Telephone counseling. Telephone counseling may be used as a primary counseling approach or as follow-up. Many clients with hectic schedules find it easier to arrange telephone counseling than to schedule face-to-face. The disadvantages to telephone does not allow you to detect nonverbal communication. When using telephone counseling, set goals and map out the strategy. Make sure to inform the client about how and when you can be reached. If you are using the telephone for follow-up, it is best to schedule a time. Having an appointment helps keep the patient accountable to the expected behavior and to reinforce the information. Okay, so telephone, pros, cons. Pros, it's easier to schedule. Cons, you can't see the person. Maybe they're uncomfortable. Maybe they don't want to talk about it right now. you can't see that. And then it goes over just kind of some of those basics, like if you're only communicating by phone, how are you going to do that? You need to tell them when you're available. Okay, cool, got it. That was the whole section on providing counseling. Providing counseling under the topic of health promotion. We talked about individual counseling, telephone counseling, and what counseling is. So now I'm going to jump to the end, okay? But you would repeat that. You go through the whole thing. Now in this book, they have, knowledge check. Identify 4 strategies to help a client engage in positive lifestyle changes. So we're going to encourage them and remind them that they're doing a good job with what they've already done. We're going to remind them that we believe in them and that they can do this. We're going to set a plan. We're going to write out that plan and have them sign it. And then we're going to encourage them to put it somewhere where they can see it regularly and be reminded. Okay, well, we just walked away with 4 good strategies to help a client in counseling engage in positive lifestyle changes. Awesome. Now, this book has kind of like a summary. They have like a care plan, essentially. So if you have a book like that, you always want to read through your summary. Always, always, always. Because, again, it's going to summarize those key points. Tell you what you want it to take away. Let's see if I can find any practice questions. List health behaviors that negatively influence health status. So we didn't go over those necessarily in that little section, but they did mention some. What was it? Smoking, eating an unhealthy diet, and then the questions refer to the whole chapter, so we didn't really cover it. But right off the bat, you had some you picked up some just in that one paragraph. So really nice job. Let's see if I can't find any other practice questions that were thrown in here. Okay. I don't think there were any questions at the end of that chapter. But if there were, just like, there was that one that we did. So nice. I'm gonna flip again. We're gonna find another random spot. I'll do one more with you guys, okay? And then if you have questions, leave them in the comments and I can kind of go over them with you as well. Okay. How about sleep deprivation? Okay, sleep deprivation is actually, okay, let's do this. This will be a good one. This will be a really good one. Because students are, we tend to have lack of sleep. All right, so sleep deprivation, that's your header. We are under the chapter of sleep and rest. Makes a lot of sense. So sleep deprivation. Sleep deprivation, it's in bold, pay attention, is a NANDA International Nursing Diagnosis. If you're not a nursing student, NANDA is just like the governing body that determines actual nursing diagnoses. It's like the DSM-5 for psych. I think I said that wrong, but you know what I mean. So sleep deprivation is a NANDA International Nursing Diagnosis. Cool. It is not actually a sleep disorder, but rather a result of prolonged sleep disturbances. It can result from NREM or REM deprivation or both. Okay, so right there, we're going to pause. If you don't know what NREM and REM are, you're going to want to look those up. If you know where they are in your textbook, go find them. If not, Google it really fast, get your answer, and keep going, okay? So it's not actually a sleep disorder, but rather a result of prolonged sleep disturbances. Okay. Signs and symptoms of sleep deprivation include daytime drowsiness, impaired cognitive functioning, restlessness, perceptual disorders, slowed reaction time, irritability, somatic body complaints like hand tremors, and a general feeling of malaise. Functional imaging studies contrasting sleep-deprived and well-rested brains reveals the importance of adequate sleep for memory and learning. If sleep deprivation is severe and prolonged, delusions, paranoia, and other psychotic behavior may occur. Studies of sleep-deprived adults reveal changes in the levels of certain immunoglobulins and other markers of the immune system, which means going without sleep can weaken the body's protection against infection. Is there anything you already knew in there? Probably, like how you feel when you really just aren't getting the correct sleep, right? Over time, prolonged sleep disturbances. So we defined sleep deprivation. It's prolonged sleep disturbance. We talked about the signs and symptoms, which may have sounded very familiar to you. If they are, you need to get a little bit more sleep. You need to be focusing on your sleep routine and making sure you get rest because your brain needs rest. If you're going to pass those finals, you need to be rested. And then it talked about a major side effect of sleep deprivation, which is a weakened immune system. So if you're always getting sick at school, maybe because you're not sleeping enough. Next paragraph. Illness and hospital care are common causes of sleep deprivation, especially for patients in critical care units. In this environment, lights are on most of the time, and equipment, noise, frequent treatments, and assessments all combined with the client's fragile physical condition to create sleep deprivation. Likewise, healthcare providers who work long and late hours or rotating day-night shifts experience serious fatigue that can lead to medical error and patient injury or death. Okay, so in a glance, what that told us is this book is a nursing textbook. So it's saying this sleep deprivation thing, yeah, it can be an issue for students and young people and everybody, but think about your patients, right? If you're a nurse or a nursing student, your patients aren't getting the sleep they need because they're getting sleep deprivation. They're getting prolonged sleep disturbances, right? Over time, they're not allowed to sleep through the night. We're going in and taking vitals. We're going in to check on them. We're peeking in. The lights are on. Someone down the hall is screaming bloody murder because you're on a med-surg unit and you have patients who are crazy. It happens, okay? So you kind of got all that in a glance? Knowledge check. We've got questions. Let's find some that... What are the clinical signs of sleep deprivation? Can you name 3? Well, we had a general feeling of malaise. Malaise means tiredness. We had hand tremors. And we had daytime sleepiness. What are the... We just did that one. Okay. There were 5 questions here. That was the one that referred to the paragraph. We had those questions referred to 10 paragraphs surrounding that. So, do you kind of see how that works? Now, if we couldn't remember 3, we go back. Okay, let's find the clinical signs. Signs and symptoms of sleep deprivation include daytime drowsiness, impaired cognitive functioning, restlessness, perceptual disorders, slowed reaction time, irritability, somatic or body complaints like hand tremors, and a general feeling of malaise. Okay, get it? You have any questions for me, leave them in the comments. Again, please subscribe to my YouTube channel, The Hopeful RN, and follow me on Instagram where I put the spark notes of these videos. That is at The Hopeful RN. I would love to hear from you, so please don't hesitate to reach out in the comments, DM me, anything like that. If you have questions or you want more support on something, please let me know. You've got this. Good luck on your finals. Summer is right around the corner, and there is hope for you. I'll see you next time.